the other thing I want to talk about was your hormone replacement. So this is mostly for weight loss, or like what are the first symptoms that you could be experiencing where seeking you guys out for hormone therapy could be beneficial?
That's a great question. So hormone replacement has come a long way in the last 10 years, and it's something I've been doing, but in traditional medicine, I've been limited to treating perimenopausal or postmenopausal women. And there's a whole nother set of research that not everybody's familiar with. And so those newer studies that are coming out have established the efficacy and the safety of using this to treat certain conditions. And the studies are, amazing in terms of treating chronic illnesses. They found that men and women on hormone replacement, when you maximize these hormones, which include thyroid, testosterone, estrogen, progesterone, that those chronic diseases either diminished or resolved themselves. Now that sounds like a big pill to take, but it's part of a whole treatment plan. And that's what I like to stress. There is no magic fix, because if there were, we would all be doing it. But in terms of hormone replacement, those that are having signs or symptoms of having a deficiency can be treated. So typically we see people maybe mid-20s on up to 90 being treated with hormone replacement. So one of those, if you had signs of hypothyroidism or a hormone thyroid hormone deficiency, you might feel cold all the time. You might feel depressed. You might have dry skin, dry hair. You can have constipation, any of those types of symptoms where you just feel kind of down and like I have no energy. Those can be treated with thyroid replacement. And then some other symptoms of maybe a low testosterone in men and women can be varying degrees of symptoms, from no energy, feeling fatigued all the time. You can have sexual dysfunction, erectile dysfunction. Women might have difficulty with orgasms, or even desire to have intercourse with their significant other. And estrogen deficiency, we typically see varying degrees of fatigue. You have changes in the skin. You can have vaginal dryness. You can have changes in libido as well. And some will actually even get breast tenderness where they've never had it before. We've seen women complain of that during menopause or perimenopause. The average age of menopause is 51, 52. Perimenopause can start in the 30s. So what hormone replacement seeks to do is, your levels are up here, and as we age, it starts to diminish, and that's when we start feeling really cruddy. And so we start with a lab panel and just make an assessment of how we feel like we could benefit each person. And everybody's treatment plan is different. And the treatment plan always includes eating good. So, you can't go to McDonald's and eat, 3 times a day and expect to feel better. So a healthy diet, exercise, rest, get plenty of sleep. And there's lots of studies, showing the benefit of that. Spirituality, all of those things play an important role in overall wellness and well-being. So.
Yeah, no, all of those symptoms that you say, I mean, I feel like I know everyone who's experiencing at least some of those. So I did have a question come through on Instagram before we did our last one, and she was wondering about possible hormone problems that she's had since she had her last child. I think she has 4. I think there might be like a set of twins in there somewhere. I hope she's watching, so she can get this. But she was just feeling like maybe after giving birth, she's been really struggling. And so how soon after giving birth, because your hormones are going to have a reset period, how soon after that could someone come in and see you and know you're getting kind of an accurate assessment?
Yeah. That's a great question. I would definitely wait if somebody is lactating or breastfeeding, because we're going to be limited on what we can do, during that period of time. But I would give it a good, so two situations there. I would give it a good 4 months to kind of see where the hormones are going to level out, unless the person is experiencing significant symptoms of what we talked about, hypothyroidism or postpartum depression. There's lots of studies out there that show where supplementing with progesterone and or testosterone can eliminate up to 95% of the cases of postpartum depression. I wish that was out after I had my kids because I totally would have used it.
Yeah, that's incredible. So what if it's been years? What if their youngest is like 4, and could they still be suffering from problems? And
Absolutely. And we would start with a lab panel and then schedule a consult and discuss what issues they have and what struggles. The interesting thing, you brought up, maybe weight loss. For, the benefits of hormone replacement is weight loss. And it's not because it makes you get off the couch and go exercise. It's because you feel so much more energy than what you did, and I can attest to that because I was one of those. I'm perimenopausal, and I started hormone replacement last June, and I would get home from work and want to go sit on the couch. I'm like, I know I need exercise, but I'm exhausted. I feel so tired. And once starting that, it was amazing. I got home and it was really subtle at first, like, oh, I don't feel as tired. I don't feel like I need to go sit on the couch and veg for an hour because I'm exhausted. Mm-hmm. And that's when I'm like, I need to go do my part now. I need to go work out because this is what's going to make me feel better. But it's much easier to engage in because I'm not exhausted all the time.
Exactly. That's awesome. Testament to that. Is there a getting it right period where maybe you have just a couple of months when you start it where you're finding that perfect amount?
Yes. That's a great question too. Yeah. And it's different for every person. Everybody metabolizes, medications, hormones differently. And somebody might have a 2-week period where they're like, hey, I'm starting to feel it. On average, 4 to 6 weeks is where you kind of notice, hey, yeah, I'm feeling better. But some takes up to, 3-4 months. So it's very individualized, and we like to, use the lowest effective dose, and that's different for every person.
Mm-hmm. Is there a way you guys can charge that to insurance, or is that something that's elective?
So we're strictly on a cash pay basis here, but we do have the forms. And the really nice thing is that we're seeing more and more insurance companies reimburse for our services. And, we'll give you the information that you need to have that done. And it's just up to you to submit it. And some will not so much get money back, but they'll at least allow it to be applied to their deductible, which in the end saves them money. So that's nice. But I would check with your insurance company first to see if that's something that's a reimbursable service.
Did you pay with an HSA, like a health savings account?
Yeah, we've had people use their HSAs. Yeah.
That's awesome. We have an HSA and I love it.
Yeah, definitely. And we also have care credit, which is nice. You can choose up to 24 months, same as cash. So that means if you pay it off within that time, you have absolutely no interest. So that's always
nice. Yeah. That is nice. That's really nice. I love that. And you can use that for any of your treatments?
Yep. Absolutely.
That's awesome. There's so much more I wish we could talk about the weight loss thing. Maybe we can do another one on it, because I just am intrigued by you looking specifically into Wyoming rural areas and what is affecting us weight wise. And I'm just so interested, like what is it? But maybe there's probably too much to it. Is there like one thing you could kind of give us, or?
I love the whole topic of weight loss because it's multifactorial and it's complicated, obviously, because you wouldn't have, 40% of our American population that's overweight or obese. And we are doing some forms of weight loss. We haven't quite yet because we've had such a huge change in our practice and what we're offering now, but we want to pick a very, very good, very broad weight loss program that'll meet the needs of our community and not just a cookie cutter. Here we're going to do, the keto diet and everybody's got to do it, because it doesn't work that way for everybody. So in the future, look for Benessere to have, a more formalized weight loss program. But in regards to that, my little mini research project for my capstone for my doctorate involved Riverton, Du Bois, and Casper. And basically, in a nutshell, we looked at barriers that prevented weight loss, and then we looked at facilitators. And it was really interesting because weather was a huge factor. That was probably the biggest take home, is that we often say, well, I can't exercise because it's cold out or it's this or that. And so that was very helpful for me when I developed, a specific weight loss plan at the community health center where I work. That's one thing that I point out, like, these are barriers, but how can you overcome them? Do we need to go buy some weights? Do we need to look at some YouTube videos or buying some videos? What can you do at home where you don't have that barrier? And facilitators was the weather as well, which was interesting that, hey, we have pretty nice weather here. So we can get out and we don't have, the safety issues. People will walk down the street or walk down the bike path and not feel, afraid. So
Yeah.
those are probably the top two.
That's awesome. Thank you for sharing that.